tablet and put it in the sentence. So if it gets a little confusing, that's the reason why. I didn't know there were no books on this. But regardless of that, we're going to talk about the bones, joint, and soft tissue diseases and disorders. Hopefully this is all easy stuff for you. And it works better if why is it not working? Okay, let's try this again. Sorry, it worked. All right, so here we go. Your chapter objectives. I always read these. I know I'm boring the snot out of you, but I have to say this because this is the whole gist of your the class here, the chapters. So you want to review and outline the process of bone formation, maturation, reabsorption, remodeling. You need to know that in real life, well, not only for testing, but real life, because when someone breaks a bone, you have to know if they have any comorbidities, plus also the healing stages of the bone, so you don't re-break it. Has anybody actually re-broke a bone? Yes, I have. Not on me personally, but on a patient. Review and outline the role of mechanical stresses in stimulating bone growth, repair, and strength. This is the fun part. That's where you go into the hospital and people say, oh, I'm here for bed rest. Heck, you are. The more you move, the better off you are. Discuss diseases affecting bone, articular cartilage, and joint spaces that affect movement and function. That's simply arthritis or joint replacements and such. And discuss diseases affecting soft tissue that affects movement and function. So we're going to talk about contusions and sprains and strains and all that stuff also. And I'm sure all of you, well, most of you live in bubbles, I guess, so this might be new stuff to you. All right, now, I didn't want to bore you, but I know Bio 150 as bone composition and bone remodeling. There's a whole chapter in regards to it. So I know all of you kept your outlines from Bio 150 and passed with 100%, correct? Good. So that's going to help out with you there. Bone remodeling disorders, though. You know how bone remodels. Now we want to talk about what's going to keep it from healing. So these are disorders that affect the remodeling process. The main thing is osteoclast and osteoblast. Does that all sound familiar to you? I just started. Don't worry. I'm fine. You're fine.
Me?
Yes.
What were you saying about me?
Oh, you don't want to know.
Wait, what?
Today's Marcus Day. All right, so the osteoclasts reabsorb existing bone tissue, and it's critical to maintaining and repairing compact bones in a skeleton. Sometimes you get too much bone growth, and you'll learn about diseases in regards to that. And then the osteoblasts work in conjunction with the osteoclast, so you have normal bone, and you heal if you break a bone. Does anybody, now you're all too young to have non-unions, does anybody break anything that just didn't heal correctly, or you, really? Ow. Yeah, that thing doesn't heal at all. Okay, so the osteoblasts form bone, osteoclasts reabsorb bones there, so you can see if you have a disorder, you can get too much bone or too little bone. Promise, I just started, so okay. Marcus was talking bad about you, too.
Who's Marcus?
Right there. All right, so metabolic bone disorders, or diseases here. So, basically, you know what your metabolic system does, correct? Well, if it's not functioning correctly, it's going to disrupt the normal metabolism within the skeletal system. So, this second dot here is from Bio 150. You remember everything that's involved with the bones, correct? As in the cortical, the trabecular bone, and all that stuff is you need to have a strong bones and teeth. So, disruption and homeostasis of the skeletal metabolic process, here's where you're going to get, if you have that, you're going to be deformed. Everybody heard of rickets? You kind of bow-legged a little bit. You have winging scapula. You have a bird cage type chest. You have a sunken chest, all that kind of stuff. So if all this stuff is happening, now we're going to have deformity, bone loss, break your bones real easily or fracture real easily. And then you're going to have arthritis, and the end result is pain. Just ask her. I'm surprised you're sitting. All right, so now, here's the metabolic bone disorder. It's osteoporosis. And it presents with decrease in bone mass. So in other words, you start, your osteoclast, osteoblasts are all screwed up, so you start getting rid of the bone stuff. Just started, so just come in here, relax. Talking bad about you.
Well, maybe he wants us to wait until Monday then. Instead of Wednesday.
All right, so, and here's what the primary effects of it. That's the bone portion here, declining osteoblast portion of it, and then here's your etiology. So therefore, Brianna is going to tell everybody what etiology means.
Etiology are causative factors.
See, Marcus, you were wrong. So, the biggest thing with the primary osteoporosis can include idiopathic. What's idiopathic mean? It was, everybody kept putting on in the test, but it wasn't the correct answer. So tell everybody what idiopathic means. No, we got her on hand. Oh, she's going to answer. Bingo. It just showed up for the heck of it. Everybody uses idiopathic. It's like we're still trying to figure out Jeremy's idiopathic. Just don't know where he came from. Postmenopausal. Yay. I'm glad I'm a guy. All right. Or you can have involatile or sterile osteoporosis. Sexually transmitted disease can turn around and lead to osteoporosis. The neatest thing about osteoporosis is 99.9999% are women, but the best way to cure it as a female is exercise. The more you exercise, the more the bone grows. Secondary osteoporosis can occur as a result of another primary condition. That's just it. You could have another pathology. Your liver, kidneys, something of that sort will go ahead and start giving you an osteoporotic condition. And then the big one here is certain medications. So, Brandy's an IV drug user, so she's going to end up with osteoporosis. She has to take it because her coccyx hurts. All right, here's some of the signs and symptoms. Now, this is the stuff you want to make it kind of simple. Try not to memorize all this stuff. This is going to be your next test. It's going to be all individualized conditions, and I'm going to ask you to give me a sign and symptom of osteoporosis. What could cause it, etc., etc., etc. So, some of them include compression and other bone fractures. 99% is usually the spine, just from just collapse. I've seen people actually walk down the stairs, take a step, and crack their spine. Compression type fractures. Okay. Low thoracic or lumbar pain. So it's going to kind of hurt in the lower part. Especially women sit there and they think they have kidney issues, which is really weird because, yes, kidney issues will cause lower thoracic and lumbar pain, but you can also be osteoporosis. Loss of lumbar lordosis. So, let's see. Stand up and show everybody what a lumbar lordosis is.
This is here. It's way back.
I call that the model's back. You ever see this model walk down the runway? You stick their panties out real far just so the dress fits better and looks better. Good job. Could have been a model.
tall.
I wish. Not tall enough.
And then here's your deformities that we talked about. Kyphosis. Okay, David, stand up and show everybody kyphosis. You don't have it, but show what it would look like. Come on, stand up. You're tall.
Yeah, I'm tall. But I don't know what kyphosis is, so
Okay,
I can pretend. Like,
pretend.
no idea what kyphosis?
Okay,
Oh, I'm good at that.
hunchback. Let's see. So Brianna's going to be kyphotic eventually from the way you sit. Okay, decrease height. You're going to start shrinking. How many used to be 6'8", and now you're not? See, Brianna's exactly. A doe wagger's hump. Anybody know what that is? Reach back here and grab that cervical number 7. See that little bump? It just sticks out a little far. It's like somebody put a softball in that area there.
Can that go away?
No. It's because it's a deformity in regards to that.
Now, can that be a genetic thing as well? Like my grandmother has
You'll
it,
learn,
and then my
yep.
mom has it, and both my aunts
Yeah.
have it as well.
You'll learn about all that stuff too. It's a comorbidity. You have a disease that causes that too. And then finally, you have postural changes. How many? I always laugh about that when everybody walks around. It's like you walk like a little old lady. That's the ones that carry their walkers like this.
No, that's just us carrying the textbooks.
That's true too. All right, so now you're going to have to be physical therapist assistants. So you're going to have to treat these conditions. Can you cure osteoporosis? No. You want to make their quality of life even better. So, vitamin and pharmacological interventions. You don't tell them to start taking vitamins and taking medication. You just encourage them and ask them, has the doctor give you any medication? And they say yes. Are you taking it? No. Slap them silly and then say take it. All right. Proper nutrition. Older people don't want to eat. But more importantly is, if you're having all these pain problems, if you hurt, you want to eat? Usually you don't want to eat. You just eat no matter what, huh? Yeah, Marcus, you were right. Assistive and adaptive device prescription. They may have to use a walker, a rolling walker. They might have to wear a corset or a back brace or a TSLO. We do that in the summer. All right, and of course, patient education. You're bent over. Sit up. Brianna, sit up. No, you're not. Sit up. Put your honey back. Your feet don't touch. Okay. All right, somebody bring in a phone book and put it down there. That's the old days. If you put phone books there, feet will touch. All right, and then of course, another treatment would be surgical intervention or fracture stabilization. If it's crushed or compression fracture and it kind of slides to the side or something, they'll put rods and pins and needles and screws in there. So now you as therapists have to figure out, okay, let's go back to how is the bone healing? Is it healing? How much movement are they going to have if they've fused it? And this all the things you have to think about while you're treating. And then I just kind of jot this down here. Same situation on page 537 in your book, box 17.1, 17.2. Gives you some more information on osteoporosis. I just touched base on what I think is important for you as therapists to know. All right, osteomalacia. That's where the bone becomes soft because calcium and phosphorus deficiency. That's Gumby. Anybody know what Gumby is?
Yes.
Oh, good. Okay. So that's what you are. You just have soft bones. So they bend. They can break. They usually bend and not break.
Those are contortions.
Ow. No, I think that's double joint or loose joints and ligaments. I hope. There probably are some in there too. All right. So the etiology. Brianna's going to tell everybody again what etiology is because Marcus says she can't do it twice.
Causative factor.
There we go. All right, calcium loss secondary to inadequate intestinal absorption. You're not eating correctly is one. But also there's conditions where your intestines are not absorbing nutrients or releasing nutritious material. So it'll soften up your bone. All right. Phosphorus is lost secondary to renal excretion. In other words, what is your let's see, Promise? What is your renal?
Your kidneys?
Okay, good. So your kidneys are spitting out too much, or not keeping it in there to get through the body for absorption. And then, of course, a vitamin D deficiency. That all kind of goes together in there. But how many take a daily vitamin, multivitamin? So vitamin D is good. How many drink milk?
I used to drink like only milk until I was like 12, so I just got sick of it.
2 years ago, I stopped drinking milk. All right, so your signs and symptoms here is, yes, I'm not promoting go drink milk, but get some sort of vitamin D, especially you women, because you're all going to be a bunch of little amoebas laying in a chair one day. So your signs and symptoms, they're vague. You're going to have aching, fatigue, unexplained weight loss. If you're trying to lose weight, no, you don't have osteomalacia. But if all of a sudden you woke up one day or a week later and you're 15 pounds lighter and you're eating normally, then something's going on. All right, and then another sign and symptom, you're going to have a myopathy or polyneuropathy. Everybody knows what those words are, right? So I'm not going to have Brett stand up. Is that Marcus? Okay, Brett, stand up and tell me what those are. What's a myopathy?
Well, myo is typically muscle.
Okay, this goes back to medical term.
And pathology is disease.
Okay, now how about a polyneuropathy?
Multiple.
Yes, very good. All right, Marcus, stand up and clap for her. See you stand up. All right. Signs and symptoms continued. You're going to have a thoracic kyphosis deformity. You're going to be hunchbacked. Bowing of the lower extremities. There's your bow leg because your bones are soft. You as therapists, if someone is diagnosed with that, struggle with transfers and assuming a standing position. In other words, they don't want to sit down because they can't stand up. So they'll stand up more often than not. I've seen them lean against the wall because once they sit down, they can't get back up. So if I put Brianne in a low chair, she would never get up. So treatment specific, focus on the underlying etiology. Increased nutritional is recommended. So in other words, your patient education. Never thought you'd have to talk about nutrition, huh? I know Jeremy does it when I see him working, which is very few and far in between.
Yeah.
No, we walk into the room and we look at their plates there, and their trays there, see if they ate. If they didn't, yell at them. The hospital food stinks. Yes, it does, but we still got to eat it. And then pharmacological, the vitamin D or supplements, Fosamax is the big one that they have out there. It's supposed to build up bone. Of course, it gives you severe diarrhea. So it's a darn if you do, darn if you don't approach. So get into specifics here. There's a metabolic disorders. There's Paget's disease. And there you go. You have a heightened osteoclast activity. So tell everybody what osteoclast is. We talked about, so you're going to refresh everybody's memory.
They break down bone.
Are you
Right?
standing?
They break down bone.
Okay. See, in your paper, originally, years ago, when we had this used to be a 15-week course, you would get up and present your paper in front of everybody, in front of your classmates. But we don't have the time for that, so this is why I'm making you do it now more or less. All right, the process of excessive bone formation lacks true structural integrity. In other words, yes, you have bone, but if you take an X-ray of it, it's like you can see right through it. And that's where it says there, it appears enlarged but lacks strength. So you can, with Paget's disease, you have a pathological fracture. All you got to do is stand here and take a step and the bone breaks. So here's its etiology. No, Brianna, I won't make you do it.
Sure.
As a genetic component. In other words, Grandma and Grandpa gave it to you. Geographical incidence. In other words, certain locations will cause it or contribute to it. And commonly affects patients over 50 years of age. So now you have a long way to go. Signs and symptoms. Musculoskeletal pain. You just hurt. All of you hurt right now, so you're probably thinking, oh gosh, I got Paget's disease. Body deformities, there they are again. See how everything kind of duplicates? That's what makes pathology so difficult. That's why you're doing that paper. When that one last question is, what shows similar signs, you're going to have a list this long. Everything duplicates. So, same thing. Vertebrae compression, bowing the legs, and all this stuff here, your bony changes are going to be the skull, clavicle. You can have a big head, a small head, crooked head. Clavicle, one will be short, one will be normal size. Spine and tibia are common sites of bony changes. So, Paget's disease, once again, it cannot be cured, so it progresses. So, yes, I've treated Paget's disease before. All I worry about or work on is just making sure they have a good quality of life. During that stuff, then the doctors have to do their part. So, continued pain. They started getting headaches and vertigo. And then here's the big three right in there. The part that's the sad part, I guess. These people only live to probably 55, 60 years old, mainly because of mental deterioration and increased cardiac output secondary to heart failure. In other words, their heart just fails. All right, so you as therapists, what we did was, it relies heavily on pharmacological intervention, of course, but exercise, weight control, and cardiac fitness to maintain strength and motion. The big three. So, I have to call AG here since I have so many Allisons. So AG is going to stand up and say, how are you going to do these three things? Exercise, what type of exercise, weight control, and cardiac fitness would you do?
Well, we would start slow and see their heart capacity. So I would start with walking, nutrition, patient education on their diet, cardiac fitness, exercise slowly.
And how about the exercise, specific resistive exercises?
Resistant exercises. Dumbbells? The last time.
You're going to progress slowly. In other words, you're going to be learning PREs, progressive resistive exercises. In other words, when you probably work, and I still do it, everybody does it, I'm going to throw you a 2-pound weight and say do 3 sets of 10. Technically, what you're supposed to do to improve the body is you're going to do a set of 10 with 2 pounds, set of 10 with 4 pounds, set of 10 with 6 pounds. So that's what progressive is. So you want to stress the body. Just giving them a 2-pound weight and tell them to do it 10 times isn't going to do anything. Or isn't going to help as much. So, here's another box 17.6 on that page about clinical manifestations of Paget's disease. So, let's see. I haven't picked on you. Stand up and tell me what a manifestation is.
The things that bring about a disease.
You're
Signs.
you're close.
The signs and symptoms.
No, now you're way off. Go back to the first one. Yes, it's what you see.
Yeah.
You're going to present with a beard. You're going to present with a bun on your head.
If it's a bone disease, when does their heart and brain start to give out?
Because of the osteoclast, your body is working. It's just sucking everything dry. All right, so rehabilitation considerations for are generally talking for metabolic bone diseases. So you as therapists must have an awareness of signs of compression fractures and patients at a higher risk for all forms of fractures. Even osteoporosis, osteomalacia, Paget's disease, those are all going to break. Focus on both resistive training and endurance training to build bone density and increase strength. What AG was talking about. You got to come up with a nickname too. Because that other day when I said Ellie, everybody answered. People answered like, "All right, don't work." I know. I'll call you Veggie. Well, I didn't want to call you cattle that graze in the yard. And avoid treatments that exacerbate the condition or place the patient at risk for fractures. Personal trainers, raise your hands again. Forget what you do. You're dealing with really sick people. I know you probably like to push it.
Well, I've worked with EIM, but
We don't care. Just don't push it. No, I'm
Yeah.
scared.
So,
So that's just good. That's a good thing. What programs you go through?
I did ACE, but then just what I've been working at, just at my work, we work with a lot of diabetes, or I had a guy with osteoporosis, or joint replacements and that kind of stuff. So it's kind of a step between PT and like real exercise.
The thing about that is that's as a therapist, we have problems keeping people because insurance companies just say no. So I refer patients that when they're done, if they can't go to outpatient physical therapy because of insurance or whatever, I send them to a gym that has a personal trainer that went through a program. Because they can just pay. I'm just curious, what do you charge?
For the EIM program, it's $200 for 24 sessions.
So that's cheaper than going to physical therapy, actually. I know if you go to physical therapy, the initial evaluation is $275. Every treatment after that could be 45 minutes long. They're going to charge you $175 per visit. The insurance company covers a certain amount, but you have that 20% of copay. So it does get into some financial strengths.
How do you get your insurance company to cover physical therapy?
Find a new one. No, seriously. Like I said, Humana. When you become Medicare age, don't get Humana.
Okay, I'll remember that.
It's the worst. All right, now let's talk about fun stuff. All of you know this stuff. Fractures. What is a fracture? A broken bone. Simple as that. All right? It could be completely fractured, partially fractured, straight across, up and down, twisted, angles, all that kind of stuff. It could explode in that aspect. A dislocation. There's a picture of it right there. It just comes out of place, but more importantly, it stays out of place. It doesn't really pop back in. You have to go, it's out, somebody has to put it back in. Either you put it in yourself, an athletic trainer will put it back into place. Sometimes you have to go to the doctor. Sometimes fear you grab a shoulder and it pops back into place accidentally. All right? Be caused by a fall or a blow. It's usually contact sports. Contact sports, if you want to, punch your significant other, you might dislocate your finger. We actually had a girl who did that. Her student, actually, she's graduated. She's graduated now. Taking her test in October. Oh gosh, her test is in 2 weeks. They're freaking out. Right? You can dislocate ankles, knees, shoulders, hips, elbows, and jaw. Anybody dislocate anything? Good gosh.
Shoulder.
Your shoulder? What were you doing? Picking your nose?
Yeah.
I'll do it all the time.
Pulled it out.
How'd you do that?
Fell off a bike or something.
Fell off a bike? You dislocated your kneecap.
Oh, good.
Because if you dislocate your knee, probably end up with amputation. Well, then again, your coccyx is dislocated. Now, dislocated joints they usually swell, very painful, and visibly out of place. That's the biggest thing is, once it goes out, your muscles go into spasm because it's trying to protect itself. It starts to swell, so it's really hard to get it back into place. So they take you to the hospital or emergency room, they shoot you up with narcotics to numb it and such, and then they pop it back into place. So ideally is do it right away.
Would we ever be responsible for that?
Oh, heck yeah.
All right. So technically, it's a complete loss of joint integrity. That's the main thing that you want to know about a dislocation, because when we get into subluxations, it gets a little bit confusing in that aspect. Both the ends are completely separated, and it's locked in an abnormal position. Your shoulder went down, or to go forward? Roll forward. Can you pop it out yourself? Okay, so you don't have to have surgery. Anybody else can do that? Pop her hip out? Good. Stand up and do it.
I did yesterday.
We have a lot of females do that. You're all loosey-goosey, so things pop out fairly easy. Signs and symptoms, it's going to be periarticular pain. The joint instability, obviously, it's not in place. The deformity, and then you can't use it. How'd you get your shoulder back into place?
This one was 4. Pretty sure I had to get it down.
Okay. How'd you get your coccyx back in place? All right, so the treatment now for that is going to be, you can be surgery or mobilize until healed. Immobilization, let's talk about it. Okay. Immobilization just messes everything up, but you have to do it. So they put it back in place and immobilize it so the structures can heal in regards to that. So, Veggie, what would you do?
For immobilization?
Yeah, let's use that picture of the elbow. So they put it back into place and they are in a cast. So what are you going to do?
Like afterwards or during?
Yeah, they come to you for physical therapy.
Well, I'll do like range of motion.
I'm sorry, were you standing?
Range of motion?
Range of motion where?
Maybe shoulder?
Bingo, above and below. I can't stress that enough because I know a lot of therapists in the past, and maybe they still do. Well, they're in a cast. There's nothing I can do. And yes, there is. Also, you're in a cast. You can do isometrics. It's not going to move. It's not going to dislocate. So I can try to bend it. It's going to work on the bicep. I can try to straighten it out. It's going to work on the tricep. Simple things like that work. All right, manual therapy, physical agents, modalities are needed to minimize pains and promote healing. Now, the other thing, too, is the doctor will say after a week, okay, you're going to physical therapy, you take the splint off. And then you can start doing exercises or treatment. And then you put the splint back on. Then you can do therapeutic exercise to improve strength and flexibility. We don't do flexibility, we don't stretch until phase 2. Phase 1 is just going to be like passive range of motion, active range of motion, active assisted range of motion. So they're going to move it, and it'll increase motion because you're getting rid of all the stiffness. But we don't want to stretch it, because if you stretch it, what's going to happen? It's going to pop back out of place. And then, of course, here's the biggie, ADL training. So they had to teach Jeremy how to ride a bike correctly. He was trying to jump over 16 cars.
They're on fire.
They were on fire, too. All right. Now, since the dislocation is a complete loss of joint integrity, the subluxation is a partial disruption. The subluxation can literally dislocate but come right back in, or it just slides out partway. So what she's doing with her hip now is she's technically subluxating it. Because if she would dislocate it, it would be stuck out there. But now it's so loose it can slide in and out. You're going to have minor ligamentous, capsular, or muscular tendon damage. You as therapists need to know that, or understand that, or realize that. So signs and symptoms are similar to dislocations. Hey, that thing popped out and popped back in. Ouch. It hurts. So we're looking at the PT interventions. Gee, what's it look like? Identical. Because we still don't want to stretch until the second phase because it's still loose. We want all the structures like this, the ligaments, the capsule, and the tendons to heal. I wonder why it pops out. Look how you're sitting. You make me hurt. All right, Marcus, wouldn't you like to sit like that or be able to sit like that?
It's comfortable. Oh, it's
right, contusions is the next one. That's going to be a sudden blow to part of the body. Please tell me somebody had a contusion. Oh, thank you. Only 2? All right, Marcos, that's it. Brianna punched you, right? Yeah. All right, so it results in mild to severe damage to superficial and deep structure. A contusion, it could be just a simple, bang your elbow, walk into the corner of the desk. But the real bad ones, contusions, are motor vehicle accidents. There's some really deep contusions in that aspect there. So you're going to have a discoloration of deep or superficial tissue. LOM, loss of motion. Because you got that big old bruise and it bled into that area, so you're going to have difficulty in motion. So you as therapists are going to do active range of motion. So now you're going to start learning how to treat people. So active range of motion. Todd, tell everybody what active range of motion is. Bingo. They move themselves. All right? We're going to do ice. We can do compression. Or we always talk about the price mem. Still want to do some protection because you want to keep banging it. Rest, ice, compression, elevation. Manual therapy, active range of motion exercises, and such. All right, a hematoma. They're dangerous if they happen in places you don't want them to happen, like your brain. You don't want to have a closed head injury and you develop a hematoma inside the subdural and it presses on all that stuff. So, generally defined as a collection of blood outside of the blood vessels. Caused by an injury to the wall of the blood vessels. How many get those little broken blood vessels in their fingers, like they slap something and their fingers start to hurt? That's kind of a similar thing there. You have these little bruises. I guess you guys don't do much of anything.
I've never had a bruise before.
All right, hematomas can result. I'm glad she said that. Bruises, hematomas, contusions, ecchymosis, they all look the same, but the definitions are a little different. So, yes, you have a bruise. That's a bruise, but we have to find out exactly what it is for testing purposes and for treatment purposes, too. All right, okay. There's the ecchymosis. Kind of looks the same, don't it? Hematoma. The only difference in hematoma, it would look like this, except it would be like a little dome, because the blood's collecting in that one little spot there. So, there's your medical term for the common term, a bruise in that aspect. So blood gets trapped beneath the skin. My favorite thing to do is when someone bruises, put kinesio tape on there. A day later, they hold these little stripes on there because the kinesio tape sucks the swelling or moves the swelling out of that area. Ultrasound's great for getting rid of bruises. Make it dissipate. And there's your purple, black, or blue. Everybody talks about. Grandma and grandpa says, "Oh, you got a black and blue mark on your leg, right?" Now you're all too young. Anybody have grandparents still? Sean, grandparents. All right, another one is an RSI, or repetitive stress injuries. All of you are getting that right now. You're writing. You're playing with your mouse, using your mouse. So that's going to be repetitive. You just keep doing it over and over and over. Something's going to end up hurting. All right, sprain. You have to know this. First off, a sprain and a strain. A sprain is involving a ligament. Okay? There's 3 grades. Grade 1, grade 2, grade 3. You have to know this. Not only for testing purposes, but for real life, because each has their own little entity in regards to that. So grade 1 would be mild pain and swelling. Really no tear. You just kind of stretch the ligaments a bit. Grade 2 is going to have moderate pain and swelling. You're going to have some instability. It's going to move around instead of being tight. All right, you'll have decreased range of motion because of the swelling, and you're going to have minimal or some ligament tearing. In other words, this doesn't tear all the way through. It kind of partially tears. And then number 3 is going to be severe pain and swelling, and that's where just everything tears. So you have substantial joint instability. So whenever you see anybody who sprained an ankle, rolled their ankle out, and had a grade 3, you can actually take the ankle and just roll it bottom side up. It'll go that far. The only reason it doesn't fall off is because of skin. All right. So here's kind of a repetitive stress injury in here. The more technical stuff. Hint, hint. Know that chart. All right, now let's talk about strains. Same situation. It's muscular tenderness. Yes, you can really strain a muscle, but it's usually at the tendon-muscle connection, because that's where it's kind of the weakest in that aspect. And of course, there's going to be 3 braces there, 1, 2, and 3, very similar. The strain, because it's dealing with muscle, it's a little different than when you're dealing with the ligament or in the joint area. So you're going to have localized minimal swelling and tenderness. 2 is going to be local pain, tenderness, some swelling, impaired motor function. How many pulled a hamstring? I don't even know why I asked you guys anymore. Does anybody wake up in the morning? Barely. All right, then 3 is going to be a palpable defect. In other words, you can actually put your finger, you're falling into a hole. You can actually just kind of tore it either all the way or 90% through, and you just put your finger in it. So it's like, oh, check this out.
So like in March, I was teaching a class. We were doing splits.
Okay.
I know, already it was painful. And the way that I teach it, sometimes we put socks on a hard floor because you're able to get a deeper split. Well, I went down too fast, and I could feel kind of a pop, and I still have pain now. So is that...
That's basically, you had a grade 3. Well, if you hear a pop, something tore. But she has a whole bunch of other muscles. In other words, you can actually tear a hamstring. It has different connections in there. You can tear 2 of the muscle tendons, but 1 will still be there. Is it going to hurt forever? Yes. So when she turns 60, you'll see the little old lady walk. Osteoporosis. Paget's disease. Oh, no, but as I say, yeah, they don't go away. They just hurt forever. But you kind of adjust to it and such. How many hurt themselves when they were little and they still have little aches and pains? Oh, never mind. No, you didn't do anything. Why? How?
Anything. I used to ride dirt bikes, so I've been against a bunch of trees
There you
and
go.
ground.
So it comes back. So mom and dad were right. Be careful what you do when you were little, because it's going to come back to haunt you when you get older. David, may I ask how old you are?
You may, 43.
43. You have a lot of pain?
General aches and pains.
Ta-da! There we go. General aches and pains. Because I'm sure he was busy when he was well, not busy, active when he was little, or younger and stuff like that. Now Val's still too young. She hadn't heard anything. Or she heals faster. A bursitis. That's caused by an acute or chronic inflammation of the bursa sac. And everybody knows what the bursa sac does, correct? Good. All right, so you'll have limitation, active range of motion, secondary pain and swelling. The favorite one is when I worked for the, what do you call it, Greenville Growl, the hockey team. They always kept, even though they have pads, they kept falling on their elbows on the ice and stuff like that. All of a sudden, this big old, called a weenus, believe it or not. Big old swelling down in there, and it's just full of fluid, and that's a bursitis there. The other one they get is shoulders. So when your shoulder starts to hurt and stuff, it's the bursitis, inflammation of the bursa sac that's pushing on your nerve endings and all that good stuff.
Is there like a visible swell when the shoulder too?
You can, it's not like I can see it from here, but when you get close and start palpating. Oh yeah, don't be afraid to touch people. I'm sure none of you are afraid to touch people. That's the only way you can get good treatment. So what she's saying is, can you see a shoulder bursitis? No, but you can feel it. All right, here's your types of fractures. Let's go around the room. Where'd I end up? Okay, Rebecca, stand up and say what an avulsion fracture is in your own words.
tendon, a stretch, it kind of pulls off a piece of the bone.
Pulls off a piece of the bone. The reason I'm doing this is I want to keep it so simple instead of all this stuff. All right, stand up and tell everybody what a closed fracture is.
Pretty much the bone's still together and there's just a slight crack in there.
Yeah, it didn't pop out of place. All right, Jeremy, how about a comminuted fracture?
That's where it kind of busts into pieces.
Bunch into pieces. Older women, when they fall, outstretched arm, that's what they shatter. So they have to do a joint replacement. Rachel, how about compound fractures?
The bone pokes back out.
Yep, shoots through the skin. If you ever watch NFL, it happens a lot. They have their socks on and stuff so you can't see it, but after the fact, when you look at it, there's a bone hanging out. Or, if you rode dirt bikes, I'm sure you met someone who cracked something and bone came through at the time.
I have a question. You said you work with the Steelers.
Yes.
Is it true that Troy Polamalu's hair smells like pineapples and cocoa butter?
I wasn't. I didn't get that close. All right. Where was I? Green stick fracture.
A green stick fracture doesn't break all the way through, and it's often seen in kids because their bones are not fully formed yet.
Right. Perfect. But it can happen in adults with Paget's disease. They'll get a green stick. So it's just so common with little kids, but it can happen to adults also. So I've seen it happen. I've heard a student say, they were in there and says, "You're wrong on that stuff. I saw a 60-year-old with a green stick fracture." Like, yes. So I always mention that now, so it can happen. Non-union.
It's a break in the bone where it doesn't heal properly.
All right? And it's usually the 9 to 12 month period. In other words, it breaks, it just doesn't come back together. Which is why a lot of doctors do surgery. Pin it back together, it heals stronger. That way you don't have to worry about a non-union. Stress fracture.
Breaks due to repeated injury.
Right. Joggers get a lot of that stuff. Runners get a lot of stress fractures. Take an x-ray of it, you really can't see it for about 4 to 6 weeks because then it starts to look like it's got a bone growth on it, like it's healing and it's cracked. The best way to do it is if somebody says their shin's hurt, you start palpating or pressing, and if you hit one spot and they scream, you found it. That's usually how we do it. We use tuning forks also. You hit it, vibrate it, it'll come down. It doesn't go through the crack, it just stops. It should go all the way down the bone. You used to do that? Yeah. A spiral fracture.
Okay, breaking the bone due to rotation.
All right. This is the sad one. This is the child abuse. That's a red flag when a kid comes into the emergency room with a spiral fracture. And that's usually because of the parent grabbing and twisting, shaking them, all kind of stuff like that. So spiral fractures, I just threw that in there because you're going to come across it in your jobs. All right, here's the 3 stages that you need to know as therapists. The acute stage. What's going to happen, here's a hematoma formation. I don't think I have. There's a picture in your outline, too, that kind of shows it a little bit. So it's going to look like it has a hematoma around the crack there. And that's in the first 48 to 72 hours. And we consider that the first stage. It's just another name for it. The subacute stage, here's all the stuff that you've been beat to death with as far as the inflammation, or the inflammatory process, the healing process, all that stuff. So, you're going to have fibrocartilage collar. In other words, you could re-break the bone because it's just laying down cartilage and it's just not as strong. Then you're going to have a callus formation and then ossification. So it's going to start changing into bone. So the first stage, you really don't want to stress that break. The second stage, you want to be careful, or the subacute stage. And then finally, the chronic stage is consolidation. That's where the bone remodels. And if you see anybody with a broken bone, especially like a collarbone, you'll see that bump on there. And then all of a sudden, even 10 years later, it's gone. It just starts smoothing itself back to what it originally looked like. How many more slides I have here? Oh, perfect. All right, basic time frames. But more importantly, this little bold thing with the stars around it, healing, it depends on your health. you're unhealthy, then you get the non-unions or malunions and such. So you got to keep that in mind, or you want to know that about your patient, because you always ask, or it's in the notes, do they have what's their nutritional status? Do they have a comorbidity? That's going to tell you a lot of information on how to treat. So basically, 4 to 6 weeks for children, 6 to 8 weeks for adolescents, and 10 to 18 for adults. That's just, they have to be numbers in medicine. But those may all change because of what's down there in bold. Here's the dangers. Extreme swelling, and you can get a compartment syndromes. Compartment syndromes happen a lot in sports, or if you kick somebody all the time in the shin, bang into the corner, walk into the corner of the table and such. But a compartment syndrome is going to be, you're divided into little compartments. I'll use your shin as an example, because that's one of the common ones. You have 3 little compartments. In those compartments, there's different muscles. So what happens is you swell in there. So what's going to happen is it's going to swell, so you're going to have extreme pain, decreased motor function, burning. You're killing your arm, or you're killing your leg. It's dying because you're cutting off the blood circulation. So what they have to do is a fasciotomy, and that's the picture here. They had a compartment, so you just cut a Z in it, but they never sew it back together. Because if they sew it back together, what are you going to do? It's going to swell, and it's going to scar down, and you're going to get another compartment. So they leave it open, that way you have muscles and nerves have area to spread out.
Do they pack it at all?
Yes. Well, that's your job as a therapist. Of course, they're going to put gauze and all that stuff on there. They very rarely, they just kind of put a little bit of tape. They don't want to wrap it because you're going to put compression on it again. So they come to you for therapy, and you take it off, and you make sure that thing doesn't scar over. You have to keep picking it to let it heal from the inside out.
I have to keep picking.
As a therapist. Anybody who wants to do wound care?
I mean, I think it's
There
all
you
right.
go. Wound care, it's fun if you like picking stuff. All right, fat embolism can occur. You can have a pulmonary embolus. In other words, you're going to blow a blood clot. So you can do that. So here's what happens is someone has a break. They fixed it. They come to you for therapy. You have to be aware of this stuff because they could blow a blood clot or a fat embolism. So what's going to happen is dyspnea. They can't breathe, or they have a tough time breathing. Chest pain, diaphoresis. Matter of fact, all of those fancy words in there, make sure you know what they are. I don't want to go around saying, okay, Brett, stand up and tell everybody what diaphoresis is. Well, let's do it anyway.
That is one that I do not know.
Okay, then how about cyanosis? How about a rash? No. Okay, diaphoresis, sweating. Pretty much what that is. How many, you kind of break out a little sweat, not because of exercise. Something hurts, and you just start to sweat. Cyanosis, you just start turning kind of white. Dyspnea is is breathing, chest pain. You know what that is. So yeah, just kind of remember that from medical terminology, because what happens is when I ask a test question, or somebody asks the test questions, they may throw these words in there, and if you don't know what they are, you're going to have a tough time answering that question. Immobilization is brutal too, because it can cause DVTs, which is why, except for the part-timers, we did those compressions down there. We're kind of squeezing to keep the blood flowing so you don't get a DVT. A PE, pneumonia, and constipation. That's the biggest one. If you don't move, you get impacted. And then you're going to have to go in there and tell the nurse to remove it. All right, you can have a complex regional pain syndrome, which used to be called RSD. Basically, that's the same situation as your body is shutting down, or that area is shutting down. So you get numbness, tingling, swelling, etc. And then, of course, you could have nerve damage from the break. If it breaks and presses on the nerve or slices the nerve, you'll have the numbness there. All right, so up there it goes. Okay, I thought it was done. We're going to do this part here, but time is running short. So basically, what I was going to do is, if you look on page 54 in the outline, I was going to make you all get up and talk. But for time frames, factors that influence fracture healing, know this page for testing and for real life stuff. So the conditions with optimal healing would be, what we're going to do is, I would just say why. So why do you think? Brady would answer, children younger, they heal faster, they're relatively healthy. And conditions that compromise healing, taking corticosteroid medications, I would ask down the road if you guys would answer that. So therefore, in your little groups, we can take a little quiz tomorrow, just go through that. You need to know it. Then on page 55 to 56, complications of healing fractures, there's the whole list there. So if you have, some of it I mentioned, the RSD, the CRPS, but what would an infection do? What is osteomyelitis? So make sure you understand that portion too. And then next week we'll go ahead and, there's not that many of them, it's just going to be the little tables there. Those are your end-all be-alls. That's going to be your test, the little tables. Okay? All right, I should have by the end of the day numbers for your test, or grades for your test. I just got to wait for her to take she's getting a totally different test, but I just don't want Marcus to sit down and say, hey, here's question number 1, here's question number 2. And then she takes the test and they're done the same question. All right, go eat, drink, and be merry.
Thank you, sir.
You're welcome. This is the hardest for the part-timers. Now you know how I give a test. So next time it kind of gets easier as you go along.
Do you do any work with the Greenville swamp rabbits?
No. I just can't bring myself to working with something called a swamp rabbit.
I'm saying,
Like I said, I was with the Greenville growl.
yeah. I treated a few of the people there.
The swamp rabbits, yeah, they're... I'm such a NHL person. I don't even go to the games. They're so boring. They're so slow.
I understand that.
They're just not fast like I'm used to seeing.
I got you.
But it was fun when I worked it.
Oh, yeah.
That's why I love Canadians.
Do the stages of fracture healing overlap, or are they going to be?
Yeah, they overlap. I didn't. It's all the same day. It's so that's why the medical is so great.
She better get this right. It's not one of them I woke up in my sleep repeating, but I didn't. Yeah.
Or so funny.
That's what I thought.
What?
She said, I don't work with anything called a swamp rabbit.
Yeah.
It is an awful name. The Greenville growl is better. A better name, not a better chance.